CanScreen5, it's a mixture of understanding what cancer screening is and then the ability to adapt the information that you have gained to the local context that you live in.
Most of the services were down, movements were limited, but the good thing was that it was an online program. You could try to access it from anywhere.
So we're trying to juggle between the COVID work and the attending this training. So sometimes you find yourself in a place where there is no internet and you are supposed to log in and attend to the virtual sessions. But we managed to.
So we had a lot of exciting things that we learned and wanted to introduce, but COVID kind of like scaled back cervical cancer screening, and most health policy workers were not available to have the discussion.
We had now COVID coming up and adjusting to work environment that was going to be different, and then now on top of that embarking with CanScreen and the assignments, and so it was a little bit challenging in terms of organization, but we did it.
We wanted to understand the structure of how, and also learn from these countries of how an organized screening program was. So it was a challenge, but very timely for our own country-specific challenges.
We wanted to learn something that could help our country. We wanted to change the dynamics, the narratives, and we just looked at this bigger picture. It was really about being focused. It was about looking at great results that would come out from this.
For the past 2 years, we have been waiting for the face-to-face, and thankfully, it has happened. We are here in United Arab Emirates.
It was very interesting, the training, because I got so many experience.
I'd like to make a workshop to involve the target group as providers, specialists, make decisions to disseminate the information that we have learning here at the course.
Our national cancer control strategy expired last year, so we are developing the new one to last us from 2022 to 2026. We are going to target this particular group that is developing these guidelines, which we are part of, by the way, so that we can include the elements of the CanScreen5 into our strategy.
We will start with data managers, because we believe that without the data, we cannot really we cannot really know where we at and where we're going. So we'll start with that, and also making sure that our data collection and utilization is at its fullest.
So yeah, we're planning also to add to train the supervisors of cervical cancer screening program in each district.
So the first, I'll disseminate to our colleagues at the National Cancer Control Program. And then secondly, Kenya has a decentralized system of healthcare provision. So I'll organize a dissemination session for the county health department teams.
I want to start first with the ministry senior management, as well as the district health management team leadership. I believe once I can have their buy-in, it will be easy for me to actually cascade the trainings to the lower level.
De faire une restitution à l'institution qui nous a envoyé, c'est-à-dire le programme national de lutte contre le cancer, et ensuite remonter au ministère et présenter les opportunités de formation qu'on peut faire pour améliorer la lutte contre le cancer à travers la prévention.
I'm ready for going back to my country and spread the knowledge which I've got here
Quando chegarmos ao nosso país, achamos que é muito importante unificar os conhecimentos de todos os partes, os stakeholders do processo.
I would think this is a program that all countries should embark on because we all have similar challenges, as we've seen with the countries we've interacted with.
It does give a lot of light and, to what they are trying to achieve and making it more meaningful.
Bon, je ne peux seulement que les encourager à adhérer dans la mesure où vraiment il y a beaucoup d'informations.
Que deveriam associar porque os conhecimentos são de altíssima relevância, o aprendizado é de uma forma sucinta e clara e fácil de pôr em prática e com objetivos bem definidos em termos de ajudar o país a delinear um plano fazível.
It's very informative and very experiential, practice, hands-on, and it will really guide you to move your CanScreen program successfully.
Empowering.
Informative.
Marvelous.
Fulfilling.
A lot of knowledge.
Excellent.
Phenomenon.
Insightful.
Impactful.
Timely.
Excelente. Excelente.
WHO in the African region, which was participating in the training program, have heard what were the issues and challenges in countries to undertook the implementation of cervical cancer screening program. So we will be supporting the countries technically and financially to improve their cancer screening programs. We will support them in case they would like to embark on research and innovation on cervical cancer.